Hi, my name is Tasha Horton, and I am in the FNP track at Gonzaga. I have been a nurse practitioner for 3.5 years on a med-surg floor, caring for GI, GYN, endocrine, and trauma patients. For the last 2 years, I have had the opportunity of being a nurse leader on my floor as well. When I candy striped in the 1980s, I saw how nurses were often treated and disrespected. This deterred me from pursuing nursing after high school, and I decided to study microbiology instead. Over the years, however, my desire to enter healthcare and function as a provider drove me to return to school after my children were older and study nursing. I love how family friendly nursing can be, and I value the foundation working at the bedside has provided me as I work to accomplish my dream of becoming a nurse practitioner. With my many interactions with providers over the years as a patient and now as a nurse at the bedside, and then hearing of close family and friends' experiences as patients, my philosophy of healthcare and nursing has been shaped by these moments and stories. Navigating new diagnoses, working with many doctors, and moving through the healthcare system in general can be daunting, confusing, and frustrating. With many new terms, treatments, and therapies, patients may struggle to know how best to handle these new situations. As a nurse and eventual provider, my philosophy is to be a resource, educator, and advocate and support to my patients. Communicating with my patients and helping them to understand the situation and their choices is paramount to me. This philosophy has shaped my ethical standpoint, and I desire to operate in a non judgmental way, doing no harm and respecting the autonomy of my patients. Honesty and respect are critical to this as well. Through these actions, I hope to provide a safe place for my patients to come and receive the help, support, and treatment they may need. I also see my role as a nurse and provider as a way to be involved in policy and change. While helping to change things often feels difficult, I know that working in the healthcare field allows me to better understand the challenges patients may face and the needs they may have. Because of this, I have an advantage to advocate for policies that are supported by evidence based research and are created to help and support individuals in the community and nation. From a legal perspective, providing nursing and medical care puts us as nurses at risk for legal retribution, oftentimes making it challenging to care for others. I see how important it is to be educated on what I need to do to operate legally within my scope of practice and help others understand their limits and responsibilities as well. When we support each other and create a nurturing environment that provides education and guidance, nurses are better equipped to practice in safe, appropriate, and legal ways that are important to maintaining the integrity and licensure of the nurse or provider. Although I often feel like my ability to create change in the healthcare system feels limited, I have found that small things like supporting other colleagues, advocating for patients, embracing best practices, and being a leader on my unit are all things I can do to make a difference. Listening and being willing to learn and change makes a difference too. I am so excited to be on this journey to become a nurse practitioner, and I look forward to learning with you and making a difference in our communities.